Sure to me.
Yes, he did.
Well, if you don't know what fair is, you can't make it look
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9PBS.
Thanks for joining us. Like the swallows to Capistrano, we are back. Good evening and welcome back to the first Donnybrook in the 9PBS studios in about 18 months. It feels so good to be back and gather around the big green. Actually, there is no big green table for this edition, but our new set is under construction, and so we're in our temporary facilities right now. We thank everybody for joining us, and we look forward to returning to our home improvements in the next few weeks. So, without further ado, let's meet the panelists who make up tonight's somewhat roundtable discussion. Starting with the news director for the Big 550 KTRS, she's Wendy Wiese. She's also the co-host of the Jennifer Wendy Show. Mr. Bill McClellan, one of our founders from the St. Louis Post-Dispatch and STLtoday.com. Let's welcome another founder, Mr. Ray Hartmann from RawStory.com. He's also, of course, with the Big 550 KTRS and the Riverfront Times, which he founded. And the news editor for the St. Louis American, sports columnist there as well, all-around good guy, Mr. Kirkwood. Ladies and gentlemen, Alvin Reid.
Hi, Mom. I'm back.
On the second half of this program, we call that Next Up. We're going to talk to Bart Andrews from Behavioral Response, St. Louis Behavioral Response, and he's going to talk about mental health on campuses, which Wendy Wiese does bring us to a kind of tragic topic. We have had too many incidents of suicide on the nation's campuses. And Bill, I'll maybe throw this first question your way, actually. Anxiety and depression ruling the land, unfortunately. We know that at St. Louis University, we've had 2 recent suicides, and the students there are petitioning for more mental health counselors. They're entitled to 10 per semester. They want 14. Students at WashU had a similar concern last spring. First, let's talk about suicide. The way it was reported, the classes tomorrow are canceled. How do you feel about this?
Oh, I don't know. I'm conflicted. I'm always arguing for the public's right to know and full disclosure. But on newspapers, you know, we generally don't report on suicides unless they're either a prominent public person or if the suicide is in a public fashion. But young people committing suicide, the papers generally steer away from just because we're afraid of copycats and kids thinking, well, maybe I could get some attention to do this. So I was a little surprised when St. Louis University was so upfront about it, and I thought that Jeff Fowler's statement was perfectly done and had just the right tone, but I'm not sure that you really want to publicize young people's suicides.
I think you do. I was educated on this by it's a wonderful organization called Wake Up, a Project Wake Up, Film Wake Up, that is just a great film. My friends Alex Lindley and Danny Kurth, who have experienced this, and particularly in context of a couple of deaths at Mizzou. Nate Townsend did this incredible film on it. And their theme is you have to talk about it. And I respect what you're saying. Certainly in the case of any individual person, you've got to respect their privacy. But this is a topic that is very real in a much bigger way than it used to be. And they are emphatic that people need to discuss this, to talk about it. So I feel differently, but I understand what you're saying.
You make a good point.
But I think so much of it has to do, and you're right, Bill, about Jeff Fowler. It's important for every institution, I think, to get in front, you know, what they call getting in front of a story now. And it was heartbreaking to read about the concern for the freshmen who they're trying to adjust to campus life. And, you know, still in a pandemic, we remember what it was like to be college freshmen. I can't imagine how crushing that pressure has to be. But if I'm St. Louis University, I'm going to do anything I can to accommodate these students so that we don't have to cancel classes. And I realize that that's probably a fairly significant budget hit, but this is a crisis in this country right now.
Wendy, you kind of took the words right out of my mouth. I was going to say, like, I wouldn't say we were like happy-go-lucky, because starting school like in the late 70s and going to the 80s, there was pressure, there was angst. But one thing, as I've matured, and especially in having daughters a little later, at 38 and 40, that it's different now. And I think that society has to realize that it's different now. And I think there's part of the St. Louis community that would say, like, why would you cancel classes, or why would you, take these steps like this when, it doesn't impact everybody. But I think that I have come to realize, and I hope others have come to realize, that no, maybe you do stop for a day or two so everyone can, talk about it, like Ray said, and just ingest and just, understand what's going on, because it definitely would have been ignored when I was in college.
Well, let me ask you this, and Ray, you make a great point about everything being upfront. But if you were the editor of a paper and a high school child committed suicide, which happens, would you think that should be covered in the paper?
Yep. I mean, not the identity of an individual. That's a different question, particularly somebody that's a minor.
Well, that's really, if you're going to cover a suicide, don't you?
You cover, in this case, what they're really covering is the epidemic, is the problem. And it's so interesting to me to hear that this is what students are demanding. When I was in college, we weren't demanding more counselors. We were demanding all kinds of stuff.
An end to the war.
We wanted, whatever, But that it's kind of an interesting demand. But no, I think that you have to, again, you always, you have to cover. You can't have a stigma. You cannot stigmatize it
With regard to the students, though, they're asking for more mental health sessions, because medical protocol says you get for good mental health, you get 1 session a week, and there's 14 weeks in a semester, and they're only given 10, so they want 14. The problem is there are no mental health counselors out there. There's a shortage all throughout St. Louis. There's a shortage throughout the nation. So I don't really know what SLU can do about this.
Well, I think they can.
This is the exact same thing that the students at WashU were protesting last spring. Wendy, speaking of kids, they're not entirely welcome in downtown St. Louis anymore. Mayor Tashara Jones has just instituted a new curfew. The curfew starts at 11 o'clock on weeknights, midnight on weekends, Saturday and Sunday, or actually Friday and Saturday. And parents are then obligated to pick up the kids within 45 minutes after that curfew. So on a weeknight, it'd be 11:45. And if the parents show up late, they'll be cited by the police. If I had my way, the curfew would be earlier, but what about you? What do you think about this?
I agree with you, and I do think it's funny just because the image that we get when we think of parents picking up after a school mixer and, pulling up in the carpool in the minivan, and the kids who are facing curfew, jumping in the minivan and speeding off with mom and dad. I think until parents, and this is not going to be very popular, but I think until parents get out in front of this, I think, yes, they should be fined. They should be issued citations. And I agree with you, Charlie. And I think Tashara Jones, Mayor Jones, she's taking substantive steps. She's got to do something. I think by the time the little darlings, if they're already out at 11 and 12, they've had opportunities to get into some trouble.
Absolutely.
Already. So I would back that up a little bit.
I'm going to go back with Wendy. I mean, some of you all remember this. It's 11 o'clock. Do you know where your children are? Okay. I'm thinking like at 15 years old, what kid is out there running around past 11, 12?
Never happened.
Right. So I support it. Do what you can. Take those steps. It's like, a lot of parents will just disregard it. Okay, well, some will regard it. It's a step. It's something.
Right.
And we got to start doing something.
Right.
Amen to that. Is it practical, though? I mean, there's a shortage of police. There's a question, Tashara Jones is getting criticized for saying she's going to take police out of the neighborhoods and put them downtown on the weekends. And with the shortage of police, all of a sudden, there are going to be truant officers checking kids' IDs and hauling 16-year-olds into the station. I don't know if we have enough police to do this.
Well, but you know, people say like, oh, the law is no deterrent to crime. I said like, well, yeah, you take away the law and then it's the purge out there.
I agree with that.
Like, you gotta, you know, just like, maybe if you put out there like, hey, you might get in trouble if you're, you know, this age and you're out past 11. If it's 5% of the kids
and you mentioned something important. Could we all talk about Arch City Defenders for a moment? And their criticism of Mayor Jones. I don't know if I've ever heard anything more politically naive in my entire life. She has already taken so much heat for keeping that important promise that she kept to her base about closing the city workhouse with the Justice Center and everything else that's going on. I cannot, don't let the perfect be the enemy of the good. Is that what you want?
Well, just to jump in to explain, Arch City Defenders, which is an organization that supported the mayor when she ran for office and really became very prominent after the shooting of Michael Brown in 2015, was it? Well, this week, it, along with other reformist organizations, criticized the mayor because she's adding police officers to downtown St. Louis. And they also said that by enforcing some of the low-level infractions like expired license plates, that poor people will end up in jail, but not corporate types.
Well, can I disagree with my fellow founder again? No, it's a broken record. I think, first of all, I don't think curfews work. You know, I don't.
Well, then you're not disagreeing with me.
However, and it's. I think if you're in the unique situation that the city of St. Louis is, with its very unique level of problems, with difficulty with crime, I think you have to do something. I think you have to do things that might not work, but that are better than nothing. Now, it's an illustration to me of how difficult a job the mayor of St. Louis has, no matter who has it, that something as basic as staffing up, something we've all thought should be done anyway, that you and I am all for getting at the causes of crime rather than symptoms. I'm not changing on that. But the idea that you don't staff up the police to make downtown safe, the idea that that's controversial.
I'm not arguing that.
No, I know you're not.
I'm just saying, with the shortage of police, the idea of having police be truant officers.
But you don't
maybe we'll have to use holograms.
No one's saying that they're truant officers.
Well, here's what happened.
It just puts the law on the books.
East St. Louis started a curfew, so she had to do this because everyone in East St. Louis would move into downtown St. Louis. So
I don't agree with that because I don't think the curfew will make that much.
Anytime you have a curfew, you just move the kids to another city in St. Louis downtown.
So what? Now wait a minute. Now what? Now Creve Coeur and Chesterfield going to be overrun.
It could be. Richmond Heights, look out.
That's a fallacy.
This happened.
That's so ridiculous.
That's a fallacy, Charlie.
The kids are going to go somewhere.
All right.
Charlie, they're not going to follow the curfew.
Remember when Ron Henderson did that? He moved all the kids out of downtown St. Louis, and this just shows you how old this problem is. And then he put them onto Highway 40. He blocked every exit until Richmond Heights. And then the Richmond Heights police chief said, "Hey, so now look at the Galleria." I mean, it's going to happen.
That's
I'm not blaming anybody.
Charlie.
I'm just saying that's Alvin Reid. I want to ask you now. There's a guy by the name of Hoffman, and apparently he's originally from Augusta, Missouri, and he's got a boatload of money. So he's remaking wine country out there. He's bought up all the wineries. He's got boats, he's got buses, he's bought hotels, he's got housing for employees. He's really making the region. He wants it to become the Napa Valley, a tourist attraction for the Midwest. But now in today's paper, Post-Dispatch, he's getting some brushback because he's tearing down some 100-year-old trees. And he's not communicating too well, some people say, with St. Charles County officials. How do you feel about this? Are you for progress or are you a tree hugger, Alvin?
I'm for the trees. Now, we just celebrated.
I thought you were for wine.
We just celebrated the 60th Green Tree Festival.
Right.
We're about some trees in Kirkwood. And listen, there is a mindset now that progress means trees go. But in the name of progress, who cares about those trees? All right? We have to stop this. And we live in what is considered to be a metropolitan area. And we're doing all we can throughout this area to protect trees. I would tell the people of Augusta, okay, hey, you only got so many trees. And the second you want to be Napa Valley or New York City, you're going to look back and you're going to say like, man, I wish we hadn't done this. Golf course, you know, party time. Leave them trees alone. God, that's why people want to go there, because it's beautiful.
Alvin, I love trees, but I like the idea of vineyards and grapes. And I give this Mr. Hoffman a lot of credit. I mean, he's putting $100 million in, and he's, like you said, Charlie, he's from there. He's from Washington, Missouri. And I look at some of his ideas and I go, what? Like a 12-hole golf course. I think that's just not going to work. I mean, people are used to 18.
Or nine.
If he wants more vineyards, more grapes, Alvin, come on.
Bill and I can get behind that.
I do. I give him credit.
He wants more Holiday Inn Expresses. That's what he.
You know what, though? You know what's fantastic? We would be screaming bloody murder if this Washington, Missouri native were taking this development somewhere else. I mean, truly, this is going. It's going to revolutionize the area.
Yes.
Anytime, well, Ray, I mean, anytime there is progress, they had to. Did people who supported this idea at first, did they actually believe that all of the trees were going to somehow miraculously be saved? Have you been on those? Not that I spend a lot of time at the wineries, but the the little hairpin.
Yeah, 94.
I mean, and 94.
Highway, 94.
Things are going to have to change. Roads are going to have to be widened, but it might be wonderful. And he's spending his money here.
Well, recognizing that it's America, he can spend his money, great. And I hate to continue the clash of the founders here, but I mean, this guy is trying to turn, you talk about Napa Valley, he's trying to make this the silver dollar city of vineyards. I mean, it's like.
You don't know that, right?
No, it is. It's like all kitschy and stuff. And it's like, in addition to the legitimate environmental issues, again, he can do what he wants, but people can look at it, and there's all kinds of out-of-context statues, and it just feels like Silver. If you like Silver Dollar City, which is a very nice place, go there. But to me, and I know you're trying to get your lifetime passes at the vineyards, but I know that. But no,
Ray's more of a Rain nightclub kind of guy.
I just think the thing about the wine country that's so nice is how unspoiled it is. And again, I think everybody has the right he has a right to do what he wants, but others have the right to say,
well, Ray,
this is tacky.
Silver Dollar City and Branson are pretty popular.
They are popular. That's what I'm saying.
But
they're
Lake
not
of the
wineries.
Ozarks is a kitschy place.
Well,
I mean,
exactly.
I know, but not. I'm saying I would prefer the wineries not be kitschy. That's
all right. I didn't realize Ray was so highbrow, but
I am
totally.
Drink
wine.
I don't. I do sometimes.
It's
I like
about
Missouri wine.
appreciating nature. I mean, what? Bambi's got to get hotel points now to hang around? I mean, it's just too much.
Oh, you guys.
Okay, my first wine was drink out of a screw top, so I don't want to be here.
Annie, and her name was Annie.
Ray,
Ripple and Swizzle.
Got to give Cori Bush, the newly elected congressman from St. Louis, a lot of credit. She is working her tail off. She's on one issue after another, but one that's near and dear to her heart because she once was homeless is evictions. And again, she's saying that there should not be an end to the eviction moratorium as the Supreme Court of the United States ruled. And there's also another looming deadline because the Treasury Department, which runs ERA, the Emergency Rental Assistance, has a September 30th deadline. And cities, towns, counties, states that haven't spent 65% of their emergency rental money have to give the unused portion back. So she's saying, hey, we have to institute the moratorium once again. And I'm thinking, okay, she's got a lot of good press conferences, but you really have to get into public policy and then figure out how that money gets to people. It's not, you can't govern by press conference. You have to come up with the suggestions to make this program happen. How do you feel about that?
I think she's done just great on her end, meaning there is nobody to speak for these people that are getting, I mean, yeah, the business community has people to speak for it, yada, yada, yada. There is no voice for these folks. She's a voice for the voiceless. So good for her that she's out there speaking. And she made that amazing, she actually slowed the process down with her demonstration 4 or 5 nights outside of the Capitol steps. So she She's just doing fine. The problem is, and I can't figure out for the life of me, I don't know if it's the cities, the counties, what it is, how can this money not be going to the landlords? I mean, you can't really blame the landlords. The idea of the moratorium was the federal government was going to make these landlords whole. These landlords are not all a bunch of giant companies, a lot of mom and pop people. It's outrageous. It is flat out outrageous that 100% isn't going to these landlords.
Well, here's what happened. You have some states like Missouri that don't put resources into it. Meanwhile, Massachusetts has. Massachusetts has given out almost $2 out of $3. That was last week. They're probably even better now. What happened was the president announced his plan March 11th. The Treasury Department took 2 months to institute it. And then they decentralized it, which is a nice way of saying everybody's inventing the wheel. Every county, you're on your own. There's no format. But we could get on a plane to on Southwest Airlines, go to Boston, and find out that first of all, they allow the landlords in Massachusetts to fill out the form, and that makes sense. They don't do that around here. They also reduce the questions on the Massachusetts form to just 4 questions, not 50 or whatever. And they have some other practices in there, so they make this thing happen. And they follow up with texts and emails to all the residents, and we're not doing that. This state has only given out 15% of its emergency rental
and that's
assistance.
where the scandal is, because maybe they could take a couple minutes off for fighting for the freedom to spread infectious disease to do something called govern.
Congressman Bush has to get with it. She's got to say, okay, she's got to look at the policy.
She can't affect the state.
I'm going to agree with Ray. He can disagree with me
on
stuff.
I hate disagreeing.
This is not Cory Bush's problem that the state of Missouri doesn't know how to administer a program.
It's a federal program.
Yes, and the states have to administer it.
And there have to be
and
people,
we're not doing it. It's not Cory Bush's fault.
And all of this requires a lot of processing. And if I'm understanding things correctly, there's nobody to process a lot of these things.
That's correct.
So
that's 2 points. One, I would govern by press conference because I couldn't be bothered with my colleagues or the people I represent. All right. And then 2, somehow or the other, we mysteriously got those, like emergency help America checks without any muss or fuss. I don't think necessarily that Cory Bush could make it happen like that, but I would say, let's skip the middleman. Let's just send these checks out. Somehow, mysteriously, people got them at their house. We can't get them to landlords.
Right.
I would fight that.
Bill McClellan, let me ask you about policy in the state of Missouri. KCUR, the public radio station in Kansas City, has a report that we, as a state, Missouri, have lost about $370 million in federal highway money because we have a law, probably put into law by the late, great lobbyist John Britton, which allows people in the state of Missouri to drink alcohol in a car as long as they're not driving it. So the passengers of a car can have open containers and imbibe, but that's against a federal guideline. And the federal government says, if you do have that rule, some states have it, we take those federal highway dollars and we don't allow you to use them to build roads and bridges. Well, what do you think? Should Missouri now change its law so we can get those funds?
Well, I just have no faith in Missouri doing anything right. I mean, I think we'll be coming back from the vineyards on Highway 94 with everybody drinking wine. I'm sure that the people who run this state see this as a freedom issue, just like you had the freedom to not get vaccinated. You had the freedom not to wear masks. Why not have the freedom to drink and drive? I mean, that's just the way we are.
That'll be somebody's platform.
And until we get a completely new leadership in Missouri, this is what we have to expect.
Well, all right, okay. I'm driving. Bill drives, when we talk about that, Bill drives. I'm driving, okay? All right, hey, the police are by me. Here, hold this. All right, and the passenger takes it from me. Now I'm not in trouble, okay? If that costs us $371 million, then we need to forfeit that $371 million.
Yeah.
I said that was a bad idea.
So they
the
give you a
whole picking up a margarita and driving away and all that.
You like that, right?
Right. No, come on. Let's.
Oh, that's right. You were.
Yes.
I thought that was.
We should willingly give up the $371 million. And the reason that all states basically got behind the seatbelt was because the federal, traffic, I forgot whoever does it, but they said hey, don't pass the seatbelt law, okay?
It's all about freedom here,
This
Alvin.
was well stated by the founder. However, I got to say, as far as people coming home from the way the wineries are going, are people going to be going through their tchotchkes and stuff that they bought at the wine, the gift shops, the wine
ashtrays, their shot glasses and their
it's not going to be like the little things with the snowflakes and stuff. No, I mean, it's like, but as far as I think for real that this has to be repealed yesterday in Missouri. May John Brennan rest in peace. It is an outrageously stupid thing. The statistics show that when you get rid of this practice of drinking in a car, you cut DWIs by 17%. At least that was in one of the stories I was reading. And it is outrageous that Missouri deserves to lose the $371 million, but there's no reason for it. I mean, what? And again, is this another freedom issue? I mean,
it's ridiculous. Just for safety and guardrails.
It's crazy.
You get the money.
No, we shouldn't even get that money. The feds should not. They should.
I agree.
The feds should pull the money. But how hard is it to ban this? What is exactly the argument for drinking in cars exactly? Help me out.
Well, because you are going from point A to B and you're drinking and you're not driving. It's freedom.
No. It's so ridiculous.
That's all the time we have tonight. You can always send your comments and compliments about the program, maybe a few complaints or questions, to Donnybrook, care of 9 PBS. 3655 Olive, 63108. Don't forget you can email us at donnybrook@9pbs.org. Remember to tweet using hashtag DonnybrookSTL. Don't forget, if you miss one Donnybrook, shame on you, but you can catch us later on our podcast. Stay with us for Donnybrook Next Up. Joining us in studio, Bart Andrews. He's the Chief Clinical Officer at Behavioral Health Response in light of the recent suicides at St. Louis University and anxiety and depression on local campuses. We thought we'd talk about mental health, and that's on Next Up, just around the corner on 9 PBS.
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9 PBS.
Thanks for joining us for the second half. We call this Next Up, Ray, and the two of us are next up in the, it's not a new studio, it looks like a new studio. We're not in that Rathskeller anymore.
But as always, Anne-Marie and everyone here at 9 PBS has done an amazing job getting us back.
So amazing, the lighting actually makes me look 25% good, which is
I don't know.
First time in 33 years.
I was thinking 15, but yeah. I know it's 0 for me, so but anyway, no, it's great. It is great to be back, and it is, it's been nice to have an option such as Zoom, but it's a big difference.
Honestly, if I don't do another Zoom conference for the rest of my life, I'll be fine.
I think you speak for a lot of people on that.
Ray, we talked about a very serious topic on the first half of the program, and that, of course, was the anxiety and the depression and the suicides that are experienced at American campuses way too often. And as a matter of fact, classes at St. Louis University are canceled tomorrow. School officials want the students to focus on their mental health. So we thought this hour we would also focus on mental health with Bart Andrews. Dr. Andrews is the Chief Clinical Officer at Behavioral Health Response. And we thank you very much for joining us on Next Up, taking time out of your schedule. How are you?
I'm doing well. Thank you both for having me. It's such an important topic that we're talking about.
Amen. Well, what are your overall thoughts about the anxiety and depression, and I'm sorry to say suicides on American campuses?
Great. So let's talk about it. There's a couple of things that everybody needs to know about that's going to be a little surprising, I think. The suicide rate's down. It's been down 2 years in a row. It dropped during COVID, one of the largest drops we've seen, 5.6% across the nation. Dropped in most countries, by the way. At the same time, depression and anxiety are up. So we used to say, oh, depression and anxiety cause suicide. This is the main driver of suicide, but it's not. Much more complicated. So we're seeing higher levels of emotional distress, but we're seeing lower levels of suicide despite local occurrences.
What are the drivers for suicide?
It's a wonderful question. There's a bunch of prevailing theories. The most common and the most supported by research now is called the interpersonal psychological theory of suicide. 3 things drive suicide behavior. Differentiating people who have suicide thoughts from people who act on those thoughts. Really important distinction. One is a sense of belongingness. When people have a thwarted sense of belongingness, they don't feel connected to something larger than themselves, belonging to a group, that increases risk. A sense of burdensomeness, people who feel they're a burden to others or that they're a failure, that their life doesn't matter, that in essence their death is more valuable than their life, and we see that with insurance policies, which we could talk a little bit about. And then the third factor is capability for harm. It's actually really hard to kill yourself. People think that people say things like, it's the easy way out, coward's way out. It's incredibly difficult. As a suicide attempt survivor, I can tell you, it's incredibly difficult to kill yourself. And so it takes effort, practice sometimes, or lethal means. And so this is one of the reasons, for instance, you see the suicide rate among physicians is 3 times the rate of the general population. They've learned how to overcome the life instinct. Their risk is higher. So those 3 things, when you put those 3 things together, I don't feel like I belong, I'm not connected, I'm feeling like a burden or a failure, and I've learned how to overcome that life instinct, or I have access to lethal means, like a firearm, risk goes up, and risk can spike very quickly.
Doctor, did you just say that you're a suicide attempt survivor?
Yeah, I'm a suicide attempt survivor. Attempted suicide in 1998. As a psychologist in training, I kept it a secret for 16 years because there was so much shame and, as you can imagine, discrimination around being a suicide attempt survivor. So it wasn't until 5-6 years ago I started talking about that openly.
Well, what was your situation?
In my situation, I was on my doctoral internship. I have had ongoing issues in my life with depression, anxiety, substance use, alcohol use. While on my doctoral internship, I was working too much and my alcoholism spiked, and I ended up actually needing to go into detox. Following detox, everything got back to normal, and my current employer said I was unemployable because I was an alcoholic. Right? They were going to let me finish the internship, but they were saying I was not hireable. Following that, I relapsed a few times, ended up in police custody, and while in police custody, tried to kill myself. Very fortunate that law enforcement saved my life. It's also the last time I drank, so that was over 23 years ago.
And how long have you had your current position?
23 years.
So you went right from there?
Literally went right from my doctoral. This happened while I was on my doctoral internship. Within 3 or 4 weeks, I was working at a crisis line, talking to people with thoughts of suicide all day, every day.
How does that inform? Obviously, it must have had something to do with you choosing this life's work. How does your experience affect? Do you talk at all to people when you're? I would think you're not talking about yourself when they're calling in.
No, never do.
Right.
So really,
so that doesn't really come up then, right?
But the experience is informative and helpful, particularly if you're open and you're comfortable with your experience. I think one of the things that was important for me, and it's a point we miss in behavioral health care in general, people need to feel like they've got purpose and meaning. For me, being able to take crisis line calls, being able to help people following that crisis, it made my life meaningful. So when we talk about anxiety, when we talk about depression, when we talk about suicide in the United States of America in 2021, we don't have a behavioral health crisis. We have an identity crisis. We have a meaning crisis. people are lost in their lives. So one of the big things that's really important is we get so focused on depression and anxiety, we forget the existential crises are the things that really drive suicide crises, not the mental illness. The mental illness is a byproduct of people being lost and feeling like they don't belong, like they're not connected to something larger.
Do you ever read Viktor Frankel, or have you?
Viktor Frankel is a hero of mine.
Because he said that meaning was the key for people who survived in certain circumstances.
Vital. And in fact, he created a therapy called logos therapy, which for a while was a big deal. We don't do logos therapy anymore. You'd be hard pressed to find a logos therapy provider anywhere. We've really, unfortunately, we have medicalized the human experience. We've tried to reduce it down to your neurotransmitters, right? Give you a medication to make you less anxious or less depressed. We're not focusing on the challenges of living in modern day life and people finding meaning and connection. Look at what's going on politically. Why do you think people are so entrenched? We used to be focused on religion, family, right? Local events. We used to join Rotary clubs, bowling, if you know about Putnam's work in Bowling Alone. So instead, we're filling our lives with other things. Some people are not able to fill their lives, and COVID really intensified that, right? People feel lost, adrift. Who are we?
We talked tonight about the tragedies at St. Louis University, and it's interesting that the colleges and universities today are populated by students who are part of Generation Z, Gen Z, Zoomers, whatever you want to call them, and talk about how they are particularly impacted by the concerns of belonging and I'm sorry, how you described it?
Burdensomeness.
Burdensome.
Yeah.
Because this is a generation that grew up, was it always on? And with regard to online and completely immersed in that. How does that impact this discussion?
Yeah. So, I mean, let's talk about iGen or Gen Z, because they're a misunderstood generation. There's a great book by a psychologist, Dr. Twenge, called, interestingly enough, iGen. That's all about this generation. Wonderful data. They are an incredible generation, and in many ways, we should be so proud of them. They're more open-minded than any generation before. They're more responsible. I don't know if you know this. Drug use, alcohol use, teen sex, teen pregnancy are at record lows in this country. These are responsible, cautious, informed young folks, right? So they're often misunderstood. At the same time, they are more connected. They're more aware of the world around them. And in fact, one of the things that you're seeing, and as a Gen X, we were kind of started this process, but children are more aware of the real world than they've ever been before at younger and younger ages, right? We used to protect children from lots of the information of adult life, right? You can't do that anymore. It's almost impossible to keep kids away from the facts of life and some of the really unpleasant facts of life. So they're facing the burden, right, of an existence that has a lot of challenges in it at younger and younger ages. They're more aware. Two, what have we been telling these kids? Oh, be afraid of strangers, right? Don't get abducted. Don't do this, don't do that. We've created a generation that's much more fearful, right? They're afraid of other people. They take less risks, right? They're a little more anxious and a little more depressed than groups before us. But at the same time, they're more willing to reach out and get help. One of the problems you're seeing right now, and we're talking about SLU's. SLU's done a wonderful job, and we'll talk more about that. But right now, if every young person that's really struggling reached out to get a therapist, every clinic, every agency across the country would be in the exact same boat, because nobody is prepared for that onslaught. We've been telling kids, reach out and get help, reach out and get help. But we haven't made sure the infrastructure for the system is prepared for these young folks that are much more willing to talk about it and get help.
Well, it's funny you say that, because last spring, Washington University had a bunch of students who were protesting and writing columns in the student newspaper demanding more counseling sessions and complaining that they had to wait weeks for a counseling appointment. And now at St. Louis University, they just started a change.org petition where they have about 8,000 signatures, where the students and their family and friends are demanding at least 14 visits a semester. Because there's 14 weeks, they want one a week, and that's with a mental health counselor. Currently, they're given 10, and it's not enough. Well, where do you stand on this? Is it the university's responsibility to provide mental health sessions for the student body?
It's a wonderful question. There's a lot of layers to the answer. So first of all, what you're seeing at the surface level that's fascinating is that responsibility for young people has increasingly been outsourced out of the family environment, right? Look at schools, high schools, elementary schools, and now colleges. Parents demand more and more of these institutions and to provide roles that the family used to provide. We're professional, and this happens at every level of our economy. We're professionalizing things that used to be handled by family and friends, right? 2, is it a legitimate request? Absolutely. People should have access to those services. Is it the university's responsibility? The university is probably going to have to do it because who else is going to do it? Because we don't have a good healthcare infrastructure that would provide access for these folks through their insurance. In an ideal world, we would have a nationalized healthcare policy where you had unlimited access to behavioral health benefits. Those behavioral health benefits were reimbursed at a good rate, so we had tons of providers. You had 24/7 access to care, just like you should, and you would coordinate with the university. So sure, there would be clinics on the university that would be supported and coordinated, but we're literally trying to put the entire healthcare burden of these students on a university. And the university has some responsibility, as they should, but not all of it, right? So, and two, the level of demand you're seeing, nobody can meet that. Who can meet that?
Doctor, unlike yourself, I answer to OK Boomer. But I'm fascinated by Gen Z because, and I want to get your view on this, it feels like, I mean, just the fact that they're asking for counselors, is Gen Z more self-aware and more open to counseling and to seeking help than other generations? Because it feels like maybe they are, but I don't know.
Absolutely. They're much more comfortable talking about their feelings. So like with any generational change, there's really good things and sometimes there's unfortunate things about each generation, right? So one of my hobbies is memes, right? I love memes. The best memes are done by our young folks. So if you get on Reddit like depression memes or anxiety memes, dank memes, the level of communication and disclosure that they have around mental health, and they make it funny or sometimes deeply painful, but always creative, always genuine, right? So we have raised these kids, we've told them, talk about it. They're talking about it. The problem is we are not prepared to meet that need. So I think that the good news is they're much more willing to talk to each other about it. They're much more willing to seek professionals. There's a common meme if you guys don't know, there's a common meme, therapist memes. So there's a whole genre of meme about what my therapist says and the pains of therapy and some of the funny stuff in therapy. These are things that we would have never dreamed of talking about when I was a kid, right? So they are much more prepared to have this type of therapy and engage in it.
Returning for a moment to suicide, are there any traits or warning signs that can be picked up by somebody's friends, parents, teachers?
Yeah, let's talk about warning signs because it's one of those things where our ability to predict or identify suicide is really bad because what the research tells us is there's infinite paths to suicide, right? So there's no real good way to know. For instance, some people, depression, people say depression is a warning sign. Only a small number of people who are depressed will attempt suicide or die by suicide, right? Here are some really good things to look out for in general. Obviously, if people are talking about things like, I can't take this anymore, I want out, I want this all over, I just want this to end, things where they're clearly in their tone and in their speech, they're talking about escape and finality, right? If they're talking about suicide, if you've seen major changes in them, and this is important because sometimes those changes may be bad, but if you see a change in a kid that's been really depressed, really sad, really anxious for a while, and all of a sudden they have this upbeat change, that's something you want to check into, right? We want to be looking for things that suggest the person is feeling disconnected, talking about feeling like a failure. This is why parents, if you're paying attention, if your kids are talking about, I'm a burden to you, I'm just not any good anymore, I'm not good enough. These are things that could be indications of suicide. They might not be, but we should be talking to our youth about this too. Every American should be comfortable saying things like, hey, you've been talking about wanting this all to end and not feeling like yourself anymore. It's important we talk about this. Are you thinking about suicide? Every American should be able to ask that question, right? There's a great study where we looked at the Dutch, and there are French-speaking Dutch and there are German-speaking Dutch, right? And there's an area that's very similar in almost every demographic except their language. And the suicide rate in the two populations is very different. They live right by each other. They grow up in the same environment almost. Language is different. The one biggest difference that explained the high suicide rate from the low suicide rate was in the lower suicide rate group, they reported they were more willing to talk to their family and friends about their emotional distress, about feeling bad, opening up and getting help. Communication like this saves lives.
Returning to what you were saying about infrastructure, I don't believe that the kind of infrastructure you're talking about is currently being discussed in Washington while they battle on the infrastructure bills. But what do you think we need to do as a culture to fix this, to invest more in, so that we have more counselors and therapists and so forth? Because it's my understanding that in a community like St. Louis, there's a significant shortage, I think it's what you're saying, of people who can help. And where do you see professionally the solution line to that?
Wonderful question. I think that in Missouri, we're probably average in the country in terms of accessibility, maybe a little below average in some areas, particularly if you're uninsured, we're definitely, right? But there are shortages everywhere. We already have rationed care in this country. Right now, if you wanted to call and get a psychiatric appointment with a psychiatrist, even with good insurance, you're looking at a 3 to 6 month wait. Kids are discharged with good insurance from hospitals post-suicide attempt, and they won't see a doctor for 2 to 3 months. Now, what do we need to do to fix this? We got to spend money, right? So there's a great book called The Emperor of All Maladies about cancer, right? It's about how we got on top of cancer. Do you know how we got on top of cancer? We spent billions and billions of dollars on research and treatment, right? Nixon, in fact, we give Nixon a lot of hard time for a lot of things for good reasons, but Nixon did a lot of good things in his presidency. He ramped up the cancer dollars tremendously. We didn't even know we were being effective in the war against cancer until the late 90s. It took 30, 40 years of building infrastructure, paying providers, paying for research, making sure, look around this region, all the cancer centers going up, these Siteman cancer centers, right? We're building, growing, because there's money there. There's revenue flowing through the system. You don't see them building big behavioral health care centers. In fact, a local new hospital, will not name it, didn't add a psychiatric unit onto their hospital. Why did they not add a psychiatric unit on the hospital? You can't make money at it. Psychiatric hospital beds are money losers. The reimbursement rate is so low. Where do people make money? Where does revenue go? Cancer treatment, right? So one of the ways that you can tell what a culture values is where we spend our dollars. We spend our dollars on cancer prevention. We don't spend it on suicide prevention. Kidney disease kills less people than suicide every year. We spend about 100 times more on kidney disease prevention than we do on suicide prevention. Our values are out of whack.
What if Medicaid were expanded in Missouri? And what's the latest? Is it being expanded right now?
It is. Well, yes and no. It's supposed to be.
It is supposed to be.
In a normal world, it would be.
It's a very modest expansion. It will help, right? It will help. But it's not a full expansion, right? Our level of expansion, it's better than nothing. I'll take it, right? And Medicaid, the way Medicaid reimbursement works, look, it helps a little bit. What you need is more of a Medicare type reimbursement system, right? I mean, we even have layers of social safety net. There's Medicare, there's Medicaid, right? So we don't spend money on behavioral health care, and we have an antiquated, insufficient healthcare insurance system that drives these problems, right? We've got to fix that.
I didn't have Nixon did a lot of good things on my bingo card tonight, so I'm still trying to process that. No, but it's interesting. And I noticed you looked at me when he said Medicare. I don't know why you did that. Is this going to have to be addressed federally, do you think? I mean, in Missouri, like I say, the party in power is fighting, still going at least to put some resistance, even after the voters passed it, and even after the Supreme Court in the state was unanimous that they have to do it, they're still going to resist. Don't you think?
Our Republican legislators have decided they want my and your federal tax dollars to go to other states to help their citizens. But it's an amazing. So one, the feds are going to have to do this because one, there are states that are doing a better job, obviously some of the blue states, right? Now, some states spend a lot of money and don't get really good results, and there are blue states that do that. Maybe our next door neighbor might be an example of that, right? So you can't, spending money just doesn't solve the problem. You've got to spend it efficiently, and you've got to get outcomes. But at a federal level, we have got to restructure how we take care of folks, and we need to make, just like two things. One, dental. Why is dental not covered by your medical insurance? We've made these really weird, capricious rules that harm people, right? Behavioral health often is covered separately. There's supposed to be parity, but please, the law says parity, but there's no real parity in terms of behavioral health care. We need to make sure that people have access to care. Too, another good thing that would help is that you build in behavioral health care into the family practices, so that when you go and get a family checkup, you see your family doctor, part of that includes behavioral health evaluation. How you doing? You get the care right there. You want to revolutionize health care? That's the ticket right there. We really need to beef up primary care, give them more resources, put your care there instead of all these specialists.
You know, Dr. Ray's got kids in high school, I've got kids in college. What can people like us do to kind of mitigate the anxiety and depression in our kids, the kids that we're in contact with?
Wonderful question. I think kids that are struggling with anxiety and depression should be evaluated, determine, hey, one, we got to check and see if there's something medical going on with kids, right? With anybody, because there's a lot of things medically that can cause depression and anxiety. If medically they're clear and the depression and anxiety are at a level that medication's required, get them into therapy. Cognitive behavioral therapy is incredibly effective at treating depression and anxiety. If you add antidepressants to cognitive behavioral therapy, you get about an 85 to 90% recovery rate. And if the first antidepressant doesn't work, usually by the third antidepressant, you'll get about a 90% of folks.
And can you find a counselor in this environment?
You can find counselors. It's harder if you're uninsured. If you are insured, there are counselors out there. There's increased capacity now because of telehealth. Now, somebody was saying, oh, the students were complaining about having to wait weeks to get a therapist. That's not, I hate to say this, that's not a bad wait time. Waiting a couple of weeks to get a therapist is really, really good, right? There are times when you're getting waitlisted, you're looking at months to get into a therapist. We should literally have, and SSM, we'll give a shout out to SSM, a local healthcare provider. They created a mental health urgent care at the DePaul campus, right? So there's a mental health urgent care. We should have those everywhere. You should be able to walk into an urgent care and get behavioral health care just like you get medical care. You should be able to get services 24/7. You shouldn't have to wait, but we're not structured that way. We're just not. So, but a week to 2 week wait, that's not too bad. I'd take it.
If there is something you would assume that our 9 PBS audience out there tonight doesn't know about this subject, suicide, that you would like them to know, that you'd like to leave them with, what would it be?
Firearms in your home are incredibly dangerous if you have a loved one that is struggling with an emotional crisis. In Missouri, we have one of the highest rate of firearm fatalities in the nation. 63% of our suicide deaths are from firearms. Nationally, it's about 49, 50%, right around there, right? We're way over. The problem, firearms don't make people suicidal, but firearms are the most lethal method, and the survival rate of attempting with a firearm is about 8%, maybe 9%. And so, and people think, well, our guns are locked up. Look, I was a teenager. I was a young adult. You know how to get into your parents' stuff. We all know how to do it. Get your guns. If you have a loved one that's struggling, get the guns out of the home until the situation is stabilized. This is not an anti-gun, anti-Second Amendment. This is really about safety, right? Guns are one of the quickest ways to lose a loved one. 2, really important. Suicide can happen to anyone. You both just met me tonight. You would have never guessed by looking at me that I was a suicide attempt survivor. We all acknowledge that my family could have someone that get cancer, or my family could have someone get heart disease. The true prejudice and blinders around suicide is people think it only happens to other people, not to them personally or their family, until it happens, right? So please look out for your loved ones. If you see someone struggling, make sure that they have the crisis line number. I'm sure we'll get that out. And make sure that if you're worried about someone, ask them, are you thinking about suicide? It saves lives.
What is that crisis line number?
So you can call BHR at 314-469-6644. There's also the National Suicide Prevention Lifeline that works all over the country, and that is 1-800-273-8255. I'll add one more. There's a crisis text line, 741-741. All good 24-hour options if people need help.
And BHR is Behavioral Health Response. You've been the Chief Clinical Officer there for 23 years.
Well, I've been Chief Clinical Officer. My title changed last year, but I've been at the agency 23 years. And in St. Louis region, if you call the BHR's number, we can also send a mobile outreach to you. We send a team of counselors out to meet with you. This is all covered through the state. No charge to you. We're glad to do it.
Thank you very much. That was
Thank you.
fascinating. Doctor, thank you very much. Bart Andrews joining us today from Behavioral Health Response. What a great segment. Thank you. Very timely. Really appreciate your time.
Appreciate you guys. It's an important topic. Glad to have the opportunity.
For sure. Thanks for joining us, everybody. Don't forget, you can always share your response via Twitter, and you can follow us on Facebook. We'll see you next week at this time.
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9PBS.